Setting the scene. Orientate the student to the practice. For example, the position of the duress alarms and the activation techniques, the emergency meeting area and exit doors, which need to be clearly marked and free of obstacles. Ensure your clinical room is appropriately set up, enabling the student and yourself first line of exit. Position the student's chair nearest to the door. Your chair should also be positioned with a clear path to the door. Spend time at the beginning of each day briefing the student on the client list. Ensure the patient is well informed that a student is in attendance and they consent to this process. Develop a code word or phrase, for example, nice shoes or pizza, with your student that you will say should you feel the student needs to exit immediately. Have an agreed place for the student to exit to, for example, the staff room or the manager's practice office. Provide the student with education re early warning signs for aggression. If you are aware of a patient's volatility, inform practice staff of appointment times and ask them to be vigilant should they hear raised voices. During the consultation, ensure the patient is not seated in the pathway of the exit door. Be vigilant for early warning signs such as raised voices, change in tone, tutting and sighing, clenched fists, tightly crossed arms, clenching and unclenching of fists, finger pointing, staring, no eye contact, standing. If you feel your own anxiety levels change, monitor your student's body language. Use the agreed code word if needed. If a client has a history of violence, spend time at the commencement of each session identifying how they are currently feeling. Have there been any recent events that have distressed them? Give them permission to talk and listen non-judgmentally. This will help to decrease any internal feelings of stress or aggression. Be aware that as a clinician, your tolerance levels will be higher than that of the student. Ensure the student is protected and respected. Monitor for inappropriate behaviour toward the student. Use a calm and respectful tone and monitor your own body language. Allow for the use of silence. It can have a calming effect and allows for reflection. Where possible, agree with the patient. Ask questions that require the answer yes. For example, have I got it right? This happened yesterday. You felt very alone. It is difficult to maintain aggression when giving positive answers. Do not proceed if someone is substance affected. Check with your practice manager re management protocols. If needed, do not hesitate to call the police. Do not take any unnecessary risks. After an incident, check in immediately with your student. They may need prompting with some open-ended questions such as, can you describe what happened? What do you feel triggered the event? How are you feeling? Allow for silence, giving the student time to formulate their thoughts. Report the incident to the University Student Placement Coordinator. Check if the student would like a lift home or call for someone to collect them. Ask them to write an account of the incident before retiring for the night and bring it with them the next day. Make time at the beginning of the next day with your student to reflect on the event. Invite them to discuss their account and ask if they have any thoughts about whether the incident could have been prevented or managed differently. Inform them further follow-up and counselling is available via an external provider should they require.